Guys, this is Dee. I am making a video today, but it's not a fun or one about clothes. It's a bit more serious. It's a video I've wanted to make for a little while now because it's quite important, and I know a few people who are struggling with this right now, and it's actually quite devastating to their lives. So I really want to just jump right into it and offer some advice and some care advice and some tips and things you can do to help out here and help get you through this. So the video is about alcohol withdrawal. First of all, I want to discuss it a little bit. First of all, I want to talk to you about alcohol consumption, first of all. So there are many more people who suffer from alcoholism than even have a clue. If you even mentioned it to them, they would think it's the farthest thing in the world from a problem they have. And that's because alcoholism has become so stereotyped in our culture and in our society that people that don't fit into that box and that stereotype don't recognize that alcohol really can affect everybody. And alcoholism looks different from person to person as well. There's different types of alcoholism. There's people who will drink every single day of their life, and then there's others who will binge drink. Both are alcoholism. There's also a difference between alcoholism or being an alcoholic per se and unhealthy habits towards like problem drinking. Problem drinking would be the right words. So like drinking for the wrong reasons would be problem drinking. Drinking because you're upset, drinking because you're lonely would be problem drinking. But alcoholism is when we're getting into drinking excessive amounts, which is binge drinking now and then, or drinking even small amounts, but on a daily basis. You need that to get by, you need that to function. And it happens very quickly. Your brain, what your brain starts accepting regularly, it will start to depend on. It'll stop doing things on its own and depend on what you're taking in to do the job for it, because our brains are lazy. We've talked about this before. It will become dependent on alcohol so quickly if you drink every day and you don't realize that there's an issue with it. You think everything's fine with your couple glasses of wine after dinner or this or that until you stop. And then all of a sudden you're not feeling so good and you're like, what's going on? Why don't I feel good? Don't understand. And it's so common, it's unfortunate, but there is an answer, and anybody can stop. Anybody can, even though it's scary as hell. And the symptoms, if you've felt alcohol withdrawal symptoms, they're terrifying. They feel horrible. I've seen people in the throes of it, the worst of it, and people who are just starting, and all would agree that it's a horrible feeling. They wouldn't want to wish it upon anybody. But there is treatments that we have so you don't have to experience those symptoms and you don't have to feel the pain of alcohol withdrawal. But the underlying factor here is that it's something that needs to be done with medical help. So now I want to talk to you about stopping drinking. So I would always advise anybody who thinks they have a problem with alcohol, even if you're not sure, get medical attention first. Speak to a doctor before you do anything. Never just stop drinking, because there's things that can happen with alcohol withdrawal. It can become very serious quickly. You can have seizures, you can have heart problems, have cardiovascular like events, major ones like heart problems, like major heart issues. You can go into arrhythmia. You can have all sorts of these negative events happen as a result of not undergoing medical treatment while you're withdrawing from alcohol. So you can withdraw, we can do it, but you just need a doctor to help you do it, and then you can do it and you won't feel awful, you won't feel sick, you'll still function, and you'll come out of it and you'll be okay. And you won't feel the need to drink either, because there's short-term help and there's long-term medication that helps people who suffer from alcoholism as well. So I'll get into that in a minute, but first of all, I want to talk to you about stopping initially. So before you even stop, before you even try, when you're thinking about it, you've decided you want to stop drinking, but you're scared to death and you don't know what to do. You're going to go to your doctor, because there's something that the doctors use in Emerge. And if you're not sure if you have alcohol withdrawal symptoms, you can find it online yourself even. And we use it in the emergency department to determine how much medication to give somebody to help stop their withdrawal symptoms. And it's called the Siwa scale. Excuse me. So it's CIWA. And this is what it looks like. This is the one we use in the hospital. And it's just a series of questions and answers like, do you have nausea and vomiting? Are you experiencing any tremor? Do you have paroxysmal sweats? So are you sweating on your face? Are you sweating for no reason without exerting yourself? Are you feeling anxious? And like, are you having auditory or tactile disturbances? Like, do you have, when you touch things, are you feeling tingly or numbness? Are you hearing things? These sort of things. These are all things that can happen from alcohol withdrawal. And these are what and we ask these questions and we ask you to rate them from like 0 to 7. 7 being the worst, 0 being none. And then based on your overall score, then the doctor will determine how much medication to give you. And usually the medication used to help you withdraw is either Valium, most likely it's Valium, diazepam, or it's lorazepam, one or the other. But how much you need is dependent on the symptoms you're experiencing and how severe they are. Now, you can find the Siwa, CIWA scale online at home yourself. This is an online version I found with drop-down menus, and you just pick it, and it'll tell you how serious your alcohol withdrawal is. Now, I wouldn't count on it. You can't interpret it anyway because you're not a doctor, and all you can do is do the test yourself. Maybe you want to do the test yourself and bring it with you to a family doctor or a walk-in clinic or to the emergency department. That will always help them. I always say going in with more information, arming yourself is the best tool you can have. Maybe you want to do that, print it up and bring it in with you. Or if you go in, that's what they're going to use, and they're going to help you, and they're going to treat you, and you're not going to have any more alcohol withdrawal symptoms. You're going to be out of the danger of seizures and cardiac abnormalities, so heart problems. You're going to be out of danger of any of the dangerous side effects of alcohol withdrawal. So I also want to remind you that when you go to the hospital for anything, it's completely confidential. No one's going to tell your employer. No one's going to tell your family. No one's going to tell anybody. It's between you and the doctor. And that's it. You can even ask to have your name taken off the medical board so that only the doctor and the nurse treating you see your name on the computer screen. Any computer you go to emerge, you'll see a list of patients that are in the emergency department. You can request to have your name removed from that list even. So only the doctor treating you and the nurse has access to it. However, I want to tell you, we're treating people with alcohol withdrawal symptoms on a daily basis, multiple times a day. So it's nothing to be ashamed of. It's nothing to be embarrassed of. It can happen to anybody at any time. Anybody can suffer from this. Anybody. There's not a person that isn't at risk of suffering from this. If they have a lifestyle that enables them, that allows them to be able to have drinks on a regular basis. So you're not alone. You're not like horrible or bad or sick or anything. It's an illness. It is. But it can happen to anybody, and it's very easy. So don't ever be ashamed of it. Just don't stop on your own. Get in and get some medical help, because the stopping is the dangerous part. And I encourage you to still stop. Definitely get some help and get in there and stop, because continuing to drink is hurting you and can kill you over the long term. Stopping without help can get you over the short term. So your ideal is to stop, but to do it with medical assistance. So that's what's going to happen right away. You're going to get treated for alcohol withdrawal symptoms when you go in. You're going to stop having those symptoms, and you're going to continue with this treatment until you're detoxed. So for a couple days, until that alcohol is right out of your system, and you're not going to feel sick. You're not going to feel shaky or sweaty or feel confused or dizzy or anything. You're going to feel completely normal. And you are also not going to feel the need to drink either. You're also not going to have withdrawal symptoms or withdrawal cravings. You're not going to have cravings while you're taking these medications, which is super important as well. That's even the most important. So you're not sitting there suffering, wishing you could have a drink, feeling sick because you need to have a drink. You won't feel like you need to have a drink. And then, sorry, I have like an allergy and like my face is itching. It's yucky because I was out in the yard. Anyways. And then once you're detoxed, there's a medication called Naltrexone, and we have this now. We didn't have it many years ago, but we do have it now. And if you take it and the doctor prescribes it, which they will, once you're sober and once you've been clean for a few days, you'll take that Naltrexone every day, and it blocks cravings for alcohol. And you won't have any more withdrawal symptoms because you're past that phase already. And what the naltrexone does is stops your cravings. So you won't feel the need to drink anymore. So it's a really good treatment plan. It's really effective. It really does help you. And you can absolutely 100% stop drinking if that's what you want to do. And if that's what you've decided on, you just need to do it the right way and make sure you have medical help. Now, what I'm going to do is in the description, I'm going to write down the name of the Siwa scale, and that is the scale I was describing to you that they use at Emerge to determine how severe your symptoms of withdrawal are and to determine how much medication for withdrawal to give you. And it's one you can find online at home or one you'll just use when you go into the hospital or go see a doctor. And then I'm also going to write the name of naltrexone down. So you can go in, and when you go in, you can ask the doctor about it. Say, can you write me a prescription for naltrexone? And they're going to tell you no, not right now. They're going to tell you you have to be sober for a couple days. They might say, stay here if possible and take the treatment for this from the Siwa scale. Take your diazepam or your lorazepam until you've reached the point where they can discharge you with naltrexone. Or they might say come back in a couple days, or they might write you a prescription that's post-dated. There's a number of things the doctor might do, but you will get that medication and it will stop your cravings and your cravings for alcohol completely. Like, you won't feel it. You won't want to drink. So that's about it. That's all I had to say. I do want to really reinforce that, I mean, if you're concerned, you might think you have a problem with alcohol, a problem with drinking, you are drinking every day or you're binge drinking, get in there and see the doctor, because there's no harm. You can't lose anything. And, you know, it does cause so much long-term damage. And our liver can recover from a lot of things, a lot of damage, but it does not recover from cirrhosis or from damage caused by alcohol. So it's something you don't want to start suffering from. It's not something you want to continue if you do have an issue. So if you're not sure, get into that doctor, ask, do the test, do the doctor, see if you have withdrawal symptoms if you're not feeling so good. Tell them the last time you drank. Be completely honest about everything. It's like going to like confession. They've heard it all. There's nothing you can say that's going to shock them. So you go in, you can be completely honest, and you're going to get exactly what you need, the help you need, and you're going to feel fine. You're going to feel okay. There'll be no more withdrawal symptoms. There'll be no more feeling sick. There'll be no more shakiness and sweating and agitation and anxiousness where you feel like you can't sit still and you can't stop moving and you just feel terrible. There's none of that. None of that. It's over. The medication treats it, and you're going to feel fine. You're going to feel like yourself again, probably for the first time in a long time. And then you'll get on that naltrexone and life will be back. You'll have your life back. And as long as you stick to it, you keep seeing your doctor and you pay attention to your symptoms and what's going on, and you keep a close-knit relationship with your physician and make sure you're reporting back and the communication is going both ways, back and forth, and get over this, kick its butt, and get your life back, because there's no need for it. And there's so much treatment now that wasn't available years ago. We've lost a lot of really good people in our lives, and I'm sure everybody knows someone and who's lost someone because of alcohol, and it's devastating because there's so many treatments out there now that maybe weren't available before. So I just hate to see someone suffering that doesn't need to. So get in there and see the doctor, and I'm going to put the link, I'm going to put the name of the Siwa scale in the description again, and the name of that medication, the naltrexone, that stops long-term cravings that you'll take every day for as long as you need it to stop cravings for alcohol. And I'll put those both in the description, and when you go into the doctor, you can ask for them. And they'll tell you when you can take them and how long you gotta wait. And with regards to the immediate treatment, you won't wait at all. There'll be no waiting. It starts immediately. As soon as you get in there and you're presenting with symptoms of withdrawal, you get treatment immediately. And the other thing you can know is you'll get triaged quite highly, because alcohol withdrawal is dangerous. So you won't sit in the waiting room all night either, waiting at the hospital. You'll be seen quite quickly, because alcohol withdrawal is, again, a dangerous symptom, and it's a dangerous illness that we don't want patients suffering from. So there you have it. I hope it's been helpful. If the video is helpful, give it a thumbs up, or don't if you're shy. And please subscribe to my channel. I would really appreciate that. And more importantly than any of that, that's all nice and well and good, but more importantly than any of that, please take my advice. And if you have any concerns, get in there, get into the doctor, and get yourself some help and get your life back. All right, and I hope everybody has a lovely day. I'm going to make another video later, but it'll be a little bit on a lighter note, so watch out for that. And I'll see you guys soon. Bye-bye.